Familiarizing yourself with the BNF. The BNF stands for the British National Formulary, and it contains the latest guidance on prescribing, dispensing, and administering medicines. It reflects current best practice and incorporates both legal and professional guidelines in regards to drug administration. It is very important that you familiarize yourself with the BNF and its format before the OSCE, because the station is only 15 minutes, and so being able to navigate the information quickly is vital if you are going to complete the station effectively within the 15 minutes. In the OSCE exam, you should only really look up the drugs you are not familiar with in order to save time. You may be given a copy of the BNF when you start your new role in the UK. However, your employer should have a copy on site, and you can also access the BNF online. As a brief overview, there are 16 chapters in the BNF. These are gastrointestinal system, cardiovascular system, nervous system, infection, endocrine system, genitourinary system, immune system and malignant disease, blood and nutrition, eye, ear, nose and oropharynx, skin, vaccines, anesthesia, emergency treatment of poisoning. There are also a number of appendices, including Appendix 1, Interactions, Appendix 2, Borderline substances, Appendix 3, Cautionary and advisory labels for dispensed medicines, Appendix 4, Wound management and elasticated garments. For the purposes of the OSCE test, you should ensure you are familiar with the appendix relating to drug interactions, as this is something you are likely to be assessed on. In particular, it may be wise to focus on high-risk drugs. These include antibiotics, anticoagulants, antihypertensives, chemotherapy, insulins, anti-diabetic drugs, drugs with a narrow therapeutic index, non-steroidal anti-inflammatory drugs, methotrexate, opiates, parenteral drugs. When navigating the BNF, there is a standard format that it is helpful to be familiar with. When approaching a group of drugs, you will first be able to see the class monograph. The class monograph contains information to all drugs in the same class, such as thiazides or macrolides. You will then be able to look at specific drug monographs showing drug actions for individual medicines, alternative names for the medicine, dose, side effects, and contraindications. Remember, the way it is referred to in the UK may be different to the way it is referred to in your native country. For example, you may know a drug as aspirin or acetylsalicylic acid. Remember, many electronic prescribing services may not have safeguards built into them, but during the OSCE you will not have access to these automatic prompts, so you need to be aware of common mistakes. When considering side effects, it's the very common and common side effects that are the ones you really want to be aware of. Very common side effects are those that impact more than 1 in 10 patients, whereas common side effects are those that impact between 1 in 10 and 1 in 100 patients.